Hi, I'm Mark Kime, founder of Disaster Doc. I help experts and everyday people around the world to understand disasters so they can better protect themselves, their families, and their businesses. So I want to share with you a new opportunity that we have now looking at this new approach that applies to the culture of prevention. So there's this new global paradigm that's occurring around the world that doesn't wait for people to become victims. Instead, it empowers people to protect themselves, their families, and their livelihood. So I want to share with you a little bit of teaching here. I have in my book, my new ebook entitled Too Little, Too Late, Why You Can't Rely on Rescue. I go through the 10 reasons why disaster rescue is often too little and too late. And you can find this book in its entirety on my website. It's free actually at disasterdoc.org. I also include it in my blog as well, and you're welcome to be able to download that and read those at your leisure. But I want to share with you 5 important lessons from those top 10 lessons of why you can't rely on rescue. So these 5 reasons, I'll go through these and list these, and then we'll unpack them one by one and kind of share this with you so that you really can understand, the risks that we face in our day-to-day lives. So number 1, hospitals are not interconnected. That's one of the main reasons. Number 2, most disaster deaths actually occur during the disaster impact. And that's when most local rescue is actually impossible to deploy to you. People can't get to you during that time when the disaster is actually unfolding in front of them. And most national and international medical teams arrive too late to save the majority of the lives that are lost. And number 4, the majority of these actions taken by national public health systems actually occur on a focus on detecting deaths and illness rather than preventing them. And finally, 5, government funding for hospital and disaster preparedness is very difficult to sustain over time. So let's go look at those one by one, and I want you to better understand why it's really up to you to make a difference in your lives and your family's lives. So reason number 1, hospitals are not interconnected. What do I mean by that? Well, one thing we have to appreciate is the fact that no single emergency medical or hospital system can provide for thousands of disaster victims. No one hospital can do it. So we would have to have hospitals work together in some concerted effort to be able to coordinate and transfer patients and utilize the staff in a way that's efficient. But these hospitals are actually separate private entities. In many countries around the world, they're not interconnected. In some cases, they may be competing on other aspects of the city. They may be not necessarily competing, but they're just not linked together in an overarching system. And the government doesn't have the authority to do that in many of these types of countries as well. Some there are, but in most countries not. So this idea that hospitals aren't interconnected may be a surprise to some people. We have regional cooperation that's growing in some countries and even in the United States as well, but it's not pervasive, it's not continuous, and it's not something that we can count on. And few regions actually have joint capabilities of communication or administration between these hospitals. So what ends up happening is miscommunication is actually a common occurrence. Even medical records are a problem during patient transfers. We've seen, for example, in disasters where the patient is sent, but not their records. So they may have received life-saving interventions at one hospital and then be transferred to another without any record whatsoever of what's been done, what medicines they're on, what their medical problems may be, x-rays, and all those other kinds of diagnostic measures may not even travel with them, or they may not be able to transfer because they're electronic and the two systems don't talk together. That's just one example of the many complexities for this interconnectedness that's absent among hospitals. Reason number 2 that we can't rely upon rescue: most disaster deaths actually occur during the impact phase when local rescue is impossible to deploy. So what do I mean by impact phase? Disasters occur in 3 main phases. One is before, one is during, and one is after this disaster impact. So beforehand, of course, this may be, for example, the tornado is on its way and there may be warning, and so we have an opportunity to act then. But when that tornado is there, when that hurricane is actually there bearing down and the wind is blowing or the earth is shaking from that earthquake, there is no one on their way to you. They can't travel any more than you could with a few steps, rapid shaking, remarkable wind blowing. No one can get to you during that time. So those deaths and injuries actually do occur when that wind is blowing, when the buildings are falling down. No one is coming to your aid because it's just impossible, even though they have the best intentions to help. So most injuries and most deaths actually occur then. So we would think that rescue would help us, but actually, if rescue's not there in those first few minutes, many people die within minutes. Many people die in the first hour before anyone gets to them. That's the impossibility of rescue. And though many times we do have people that we rescue in these type of responses, and I've seen many, many years of this, we only rescue and save the lives of about 10% of the people that actually succumb to these disasters because we are just coming in too late. So it's a key issue when we're talking about your level of preparedness and your ability to prevent these things from occurring. Reason number 3 that I mentioned, most national and international medical teams arrive too late to save the majority of lives lost. Now, in the United States, we have what's called Disaster Medical Assistance Teams. We call them DMAT, or DMATs for short. And these are actually, field hospitals that we ship, we put up tents, and we provide the medical care, emergency medical care in disaster setting right there on the scene, which is a great idea. And actually, some of the first experiences that I had in my life of disaster medicine was actually providing medical care during those events. So I was in a DMAT, and we would come into those areas and we'd treat patients, and they, to this day, they still do a fantastic job. But the reality of those teams, even though they're very, very necessary, their deployment and their transport, the time it takes to activate people and get them to an airport and get all that equipment moved, the personnel usually arrive 1 or 2 days later. Now, we said that people are dying within the first hours, but the medical teams that are coming in to try to save thousands of lives actually aren't arriving for 1 or 2 days. And then even in some cases, for example, the equipment may even arrive days later. So for example, in Hurricane Katrina in the United States, where there was a very severe storm, the team from Oregon came from clear across the country. This personnel arrived, but it wasn't for 5 days later that actually the equipment was able to arrive as well. Not because of anything that they did wrong, that's just the way that it takes to transport. It takes longer to transport equipment and supplies and this complex response system. It takes a while to ramp it up. Once it's going, of course, then it's much more effective. But just in those early days, those critical life-saving days, it's very challenging to be there in time, especially when we're talking about national, and even more so when we're talking about international teams that may come from very long distances. So reason number 4, along these same lines as well, of why it's often too late. The majority of actions that are taken by a national public health system. Now this is our government many times, national public health leaders and the leadership and the infrastructure there at the national level, at the state level, many times even at the city level. Those focuses are on actually the response itself, detecting needs, detecting the deaths and illnesses and other types of damages that may occur to people. What are their needs, whether they're food, water, shelter, security, on and on. Those all occur after the disaster. But the majority of the work actually is focused after the disaster rather than before, when we need to be thinking about preventing and protecting and preparing. And so I want to share with you that idea that we really need to be thinking today before the disaster happens. I want you to join me in that process. And these majority of activities as well, most national efforts talk about situational awareness. They try to find out what's going on after the disaster has happened. How have things changed remarkably? They're collecting that information, very, very critical. But once again, you're there on the ground. The disaster is happening to you, and we really want to think in terms of that ahead of time. And that's why we're here sharing this information. So reason number 5, government funding for hospitals and disaster preparedness is often difficult to sustain over time. So it's only human nature. If you forget in the past what may have happened to you, it's bad. We always look to the future with a golden eye, right? We always think the future will be better than the past, and we forget the past. We forget the bad things that may have happened many times, and of course that's a wonderful thing because we don't live and be drawn down by these kinds of negative experiences. But one of the things we also forget when we forget these bad things is we forget the lessons that we learned. We forget the lessons that those past experiences taught us about how we should prepare, how we should be doing things ahead of time. So Dr. Irwin Redlener of Columbia University actually has a wonderful quote that describes this. He says, "It's lessons learned again and again and again." So he's really saying, of course, they're not lessons learned. They're lessons reported that people don't then take and put into their lives. And if there's anything that I've been able to accomplish in the past 20 years, it's I've learned some hard lessons. I learned those lessons as a young man standing in that devastation of my neighborhood, and then I went to disasters all the way around the world and saw people with the same mistakes again. If I'd only done something yesterday, they said. If I had only taken the extra steps to be able to do this or that, I wouldn't be here in this situation. And even Rudy Giuliani, the former mayor of New York, has even talked about this same issue of the lessons that we need to learn in these experiences. He compared Hurricane Katrina and then the storm of Superstorm Sandy that occurred in New York and New Jersey, saying so many lessons that had not been carried from one event to the other. But also this issue of not learning lessons is compounded by the fact that we also, our priorities change over time, of course, isn't it? And so one example for us is from 2005 to 2012, the money that was provided by the U.S. government to CDC as an example, 38% drop in the funding for preparedness of public health infrastructure in the United States for disasters drops during that 7 years by over a third. Once again, the disaster had occurred back in 2001 with 911 and the anthrax emergencies. A large amount of funding occurred in 2002 and 2003. And then by 2005, no major disasters, no major lessons, terrorism and so on. Luckily so, of course. But because those weren't occurring, then our priorities shifted and the funding started going down. And now we're seeing that downward effort, still continuing that downward trend to this day. As a matter of fact, in 2014, in January, 30% cut in hospital preparedness funding, $100 million cut from the budget of the United States government for hospital preparedness. Once again, changing priorities, changing economic situations. So this government funding for hospital preparedness, the idea that the government can maintain this and sustain this over time is actually not always accurate. It's a very challenging thing to do. So we have to take on that same role and responsibility ourselves. We have to be able to prepare ourselves and maintain that over time. So I want to ask you a favor. I'd like for you to join in the discussion. Join me in offering comments and asking questions and teaching me, sharing with me your experiences and expanding this out to other people and sharing that with other folks as well. You know, you can come to our website at disasterdoc.org. You can like this video on Facebook and make comments in Facebook and go to our YouTube channel and Google+, all with the intent to be able to learn from this experience and to make this a safer and healthier world for the future.